Good afternoon, everyone. I'm going to wait a few more seconds. I see a few more people are joining. My name is Erin New. I am the Division Director of the Human Rights and Fair Employment Practices Division with the Human Resources Department with Miami-Dade County. Welcome to one of several town hall webinars that we're hosting with our partners over at Jackson Health to make sure that all of our residents and employees understand the facts related to the COVID-19 vaccination. There's a lot of information out there. I know a lot of people have questions, so we've put together, again, thank you very much to our partners at Jackson, a panel of subject matter experts so that we can clarify any questions that you may have. We have a lot to talk about today. I want to make sure that we have an opportunity to answer all of your questions. I first would like to introduce to you our panelists. We have our Dr. Peter Page, who happens to also be the county's Chief Medical Officer. He's also the Executive Vice President and Chief Physician Executive and Chief Clinical Officer for Jackson. We have Carol Biggs, who is the Senior Vice President and Chief Nursing Executive. And we also have Dr. Angela Reyes, who's the Associate Medical Director of Jackson Medical Group. I just want to thank you all for joining us today. We also have a very special guest. Our very own mayor, Daniela Livincava, has joined us here today, and she's also celebrating a very important day. It's her birthday, so if we could just take a moment to wish her a very happy birthday. I hope you have a fantastic day, Madam Mayor. We can sing if you want. I'm not going to be the one, but I just wanted to hand it over to the mayor just so she can say a few words.
Thank you very much, Erin. I did push my way onto this panel because I've been so excited that we have these medical experts here to answer your questions. And of course, led by Dr. Peter Page, who I appointed on my first day in office and who has done a fantastic job guiding us throughout this pandemic. And to the other experts, we're so grateful for your time as well. The important point here is this pandemic is still with us. COVID has not gone away. The very, very best and most important thing that anyone can do is get the vaccine. And we know that people have questions and concerns. And so we wanted to be sure to get you the best possible expertise, advice, guidance that you need. So this is your time, your space to get your questions answered. You know that we have now the policy for the non-bargaining unit employees that testing is required weekly if there is no proof of vaccination. And we are talking with each of the bargaining units about moving forward that policy as well. And at the federal level, even more aggressive policies. And unfortunately, this has been politicized. I'm not here because of politics. I'm here because of your individual health and community health. And so your taking the shot is not just about you. It's about your loved ones and it's about the community. So we're here for you. The county has gone above and beyond to make vaccines available, to make testing available for you, your family, your friends, your neighbors. So really, that's all I wanted to say, that I'm here for you. If you have questions or concerns, I'd like to know about them as well, but the experts can answer your medical questions. I am not a medical expert, although I'm doing my very best to keep up with the science. So again, thank you to all of you. Thank you, Erin, for putting the program together, and to Arlene and to this great medical panel.
Thank you, Madam Mayor. I hope you have a wonderful birthday. I'm sure I'll see you later.
Yes, right. My birthday present will be passage of our budget and first reading. So thank you, everybody. See you all later.
Okay, everyone. I'm going to get started. We have a number of questions that were previously submitted. If you all have other questions that come up during the webinar, I would ask that you submit them in the Q&A portion so that I can receive them and communicate them to the panel for response. I'm going to start off with some more general questions just about the vaccine. This is kind of a multi-part question for the panel. So what is the vaccine? How controlled is the strain? And how effective is it against other strains?
You know, I can kick it off, Aaron. Good afternoon, everyone, and you know, thanks for joining us. We're excited to be here. Thanks to my colleagues at Jackson as well for coming out and helping to support the communication with our county folks. As far as the vaccines themselves, the three big ones that are currently being utilized in the United States are Moderna, Pfizer, and Johnson & Johnson. The Moderna and Pfizer are actually messenger RNA vaccines generated by that methodology. A lot of people say, oh, they're new, they haven't been tested. Messenger RNA methodology has been worked on for decades. And this is the first time that we've created vaccines using that methodology and distributed them to the public in this kind of vaccination effort. And they've been an enormous success at this point. Johnson & Johnson is a little bit more of a standard deactivated adenovirus vaccine, which has also been shown to be very effective. When they came out, you probably heard a lot of talk about 95% efficacy for the messenger RNA vaccines and a little bit lower efficacy for the Johnson & Johnson with the original strains of the virus. You know, when you look at efficacy, that's really about preventing infection. Even more powerful from these vaccines has been their ability to actually significantly decrease your risk of severe disease, hospitalizations, or deaths. And as we've seen this thing evolve over the course of the past 18 months, we're still seeing very powerful performance from the vaccines. Even with the Delta variant, the latest variant that's nearly 100% of the cases being identified now in the United States and in Florida and South Florida, these vaccines are very effective at preventing people from getting really sick. You know, a lot of people talk about whether or not you can still get the virus if you've been fully vaccinated. You can, but it tends to protect you from getting, you know, a significant illness from the virus, even with the Delta variant. There are new variants coming out there that we've heard about. They don't seem to be as aggressive yet as the Delta variant has been. It's much more highly transmissible. It's also producing more severe disease, and it's really targeting the unvaccinated population. So these vaccines are still, you know, holding their own, and they're still very effective. And we're still strongly encouraging anyone who has not been vaccinated to get vaccinated as soon as possible.
Thank you, Dr. Page. Does anyone else have anything to add, or I can just move on to the next question?
Well, the only thing I would add, Aaron, is that part of the question was, is the vaccines, are the vaccines still effective against the variants? And I think that that's a really big deal that we all need to be very, very cognizant of and really think about, because yes, they are with the variants that we have today. The problem is that viruses do what viruses do. They replicate, they change, they mutate. We don't know down the road, will a mutation come out that it's not effective against? So it really behooves us to get vaccinated as soon as possible so that we can arrest this Delta variant and this COVID-19 vaccine virus, and then go back to some semblance of normalcy. So there really is, timing really is very important, because the longer we let it drag out, the more it will replicate and mutate, and then we don't know.
Thank you very much. The second question I have for you all is, how much protection does the vaccine provide?
I mean, as we spoke about, you know, right now, as we're dealing with the Delta variant, the latest numbers that have come out, as far as the ability for the vaccines to prevent hospitalization when acquiring the virus, you know, are currently running 95% protection from the Moderna vaccine, 80% protection from the Pfizer, and 60% from the Johnson & Johnson. So we're still seeing amazing results in preventing severe disease, hospitalizations, and deaths. We do hear about breakthrough infections in people that are vaccinated, but they tend to either be asymptomatic or very mildly symptomatic. People tend to do well, if they acquire the virus after vaccination. But those are the latest percentages that have come out from some of the research and the trials that they're conducting, tracking the data currently.
Thank you, Dr. Page. Can you tell us what the immediate effects of the vaccination are?
Dr. Biggs, did you want to talk a little bit about the side effects?
So the side effects are typically, and some people have no side effects, but typically there'll be a little soreness, could be a little warm, tender at the vaccination site, would last probably about 24 hours, maybe 36. Some people, like myself, I had little flu-like symptoms, which last about 24 hours for me. Again, people have said they've had it up to 72 hours. But those are typically the side effects that we see: soreness, flu-like symptoms. Some people have a mild temperature, but those are pretty much it.
And Aaron, the only other thing I would add, people talk about the serious adverse events or side effects from these vaccines. Over 178 million people in the United States have been fully vaccinated, and the frequency of severe adverse events or reactions is so rare. It's unbelievable how safe these vaccines have been in this distribution profile. So I think it's important for people to recognize that short-lived mild symptoms compared to getting this infection is a very obvious risk-benefit ratio.
And just to add to that, so because we always want to be as transparent as possible. Couple of months back, there was the issue with the blood clot with the J&J vaccine, and since that, and again, that was one in like 6 million at the time. And if you really look at it and you compare it to things that we deal with in everyday life, the possibility of blood clot with birth control pills are like 1 in 100 or so. So I mean, we always have to look at everything in totality and not just focus on the one incident or the one thing that happened. And the good thing of it, now that we know, like with the J&J, now that they know that was a possibility, when people are vaccinated with that, it is something that that they look out for. So I mean, I think it's just important for us to continue to look at this in a broad fashion and not just find one thing and go, aha, okay, see, that's why I'm not going to get it. And again, thank you for being here, all of you, so that we can answer your questions.
Thank you. And I believe you both may have touched upon this a little, but just if there's any other long-term side effects that you may be aware of.
Dr. Reyes, you want to jump in?
So a lot of times, specifically, I'm an obstetrician and gynecologist, and many times people will ask me if the vaccine will have any long-term side effects in relationship to fertility. And so far, the studies that we have seen so far have not shown that it will increase the risk of infertility. And although the studies are ongoing, there is currently no data to support any scientific theories that it would cause that in the future. So in the reproductive lifestyle, we have seen some changes in menstrual cycles with either recently having had COVID or possibly from the COVID vaccine, but that has been a short-lived phenomenon and has not been shown to affect the actual fertility in women moving forward.
Thank you very much, Dr. Reyes. The next question I have for you all is, are there any risks to getting vaccinated with pre-existing conditions?
At this point, there really are no risks to getting vaccinated. Of course, if somebody is allergic to something, in the vaccines, but there are no risks at this point. As a matter of fact, many patients who are immunocompromised, it's recommended that they get vaccinated, because should they get COVID, their body would really have a hard time fighting it off. So again, everybody, do speak to your own physician, but at this point, the research and the data is not showing that there are any risks. There's a big risk to not getting the vaccine, though, that we could talk about.
Thank you, Dr. Biggs. How soon after a positive test should a person get vaccinated? And the second part to that question, is it the same time frame for adults as it is for children?
Typically we would say, you have to have resolution of the illness, and then meet the requirements of ending your isolation. And so essentially, if you get the infection, if you test positive or start getting symptoms and then test positive, the clock starts when you either test positive or you start symptoms, whichever is first. As you go through the next few days, if you get better and your illness resolves, they generally say 10 days from when you either tested positive or the onset of symptoms. If at that point you haven't had a fever for 24 hours, your symptoms are better, then they say that you would be eligible for your first dose of the vaccine. Oftentimes people wait because you are afforded some level of immunity from the infection itself. It's just that immunity doesn't last as long as you get with the vaccine. And so the exact time frame is very challenging. It may be up to 90 days, but you wouldn't want to bank on that. So you're better off following the criteria that has been established for starting the vaccine after the infection.
Thank you, Dr. Page. The next question, can a vaccinated person carry the virus?
Yes, anyone can carry the virus. So even once you're vaccinated, it's still important to maintain all the precautions we had in place previously, continuing to wear your mask, social distancing, and of course, washing, sanitizing your hands.
Very much. Dr. Reyes, you mentioned earlier that you specialize in obstetrics and gynecology, and we have a number of questions coming in related to the effects and risks of getting the vaccine if a person is pregnant or wants to get pregnant at some point in the future. So if you could just provide a little bit more detail and information in response to those questions related to pregnancy and conception, and what, if any, effects the vaccine may have.
Absolutely. This is a really common question in our office. In terms of getting pregnant, or the couple that is trying to become pregnant, we do recommend the vaccine for anyone who is trying to become pregnant. It should be offered to all women trying to conceive who are pregnant or who are lactating. The reason is because getting COVID in pregnancy increases your risk for a severe form of the disease. And we know that pregnancy is one of those risk factors. So as you had mentioned, you had asked if there are certain types of medical conditions that would prevent you from getting vaccinated, and pregnancy is not one of those. We actually really want you to get vaccinated if you're pregnant, because we have seen that women who are pregnant and who get COVID are at higher risk for things like severe illness requiring intubation, ICU admission. We've unfortunately seen early deliveries, stillbirths and maternal deaths from COVID. So that's why we would strongly recommend all moms who are pregnant to get vaccinated, or to get vaccinated before they try to become pregnant. And people will often then ask, so are there risks to me if I get the vaccine while I'm pregnant? And there have been observational data from tens of thousands of vaccinated pregnant individuals that's been collected by both the CDC as well as the manufacturers of vaccines. And to date, there have not been shown any safety concerns. Specifically, there was information in a recent publication of 827 pregnancies. And it actually showed that the rate of complications with the vaccine were the same or lower in pregnant people who were not vaccinated. So therefore, it meant that the vaccine did not increase the risk of miscarriage, of stillbirth, of gestational diabetes, of high blood pressure, growth problems, or preterm deliveries. But we know that the COVID itself actually can increase some of those risks. Another thing to keep in mind when pregnancy is concerned is that these vaccines don't enter the nucleus of and don't alter like fetal DNA, which is a concern to many moms. And therefore they can't cause any genetic changes. It's also not a live vaccine, which are certain types of vaccines that we recommend not receiving in pregnancy. And it doesn't contain preservatives and it doesn't replicate in the cells. So overall, we don't see risks. The only thing that we see in terms of immediate reactions are the same as those who get the vaccine who aren't pregnant. All the things that we've discussed already, like maybe headaches or body aches, soreness at the injection site.
Thank you so much, Dr. Reyes. The next question, is there anything different about the vaccine because it was approved by the FDA?
No, there's not. The emergency use authorization comes out when there's an urgent or emergent need, and they make that determination based on the totality of information available. Over the course of time, they gather more data submitted, and it reaches a different level of approval, and that leads to full approval from the FDA, but it's still the same vaccine. It's just that they have more information and more time, and they feel more comfortable giving it the full approval process, but there's really no difference.
Thank you, Dr. Page. Can you explain to us, is there any benefit related to the COVID-19 antibody test? And should a person take that test before or after getting the vaccine, and why?
So the FDA from March of 2021 is still not recommending people get antibody testing done as it relates to testing their immunity from these vaccines against COVID. There's been a lot of changes in the antibody testing. Originally, there was antibody testing that came out that we didn't really know what the numbers meant, whether or not it protected you at that level, how long it protected you for. The antibody testing has advanced, and they're now doing something called neutralization antibody testing, which is a little bit more specific towards the virus and the variants, but it's still relatively new. And I would suggest that your physician may recommend it in certain disease cases, especially if you're immunocompromised or if you're trying to decide on an additional dose. But in general, it's not supported by the FDA as far as a routine monitoring test.
Thank you so much. We have a number of questions that are coming in on the Q&A, so I'm going to move over to some of those. The first one is, in light of the data coming out of Israel that fully vaccinated individuals are 27 times more likely to experience symptomatic infection, up to and including hospitalization, than those who have recovered from COVID, why should a person recovered from COVID need a vaccine? Why is natural immunity not considered in the overall strategy?
I mean, I can start. You know, a lot of the work that they've done on the infection and natural immunity has shown waning titers of antibodies over the course of time, and they've shown that the titers from vaccinated individuals last longer, stays at a higher level, is more reliable as far as protection. You know, there's a lot of data out there coming from a lot of different sources, and some of it is conflictual. You know, I think that the other thing to remember is that, you know, it's very difficult to compare vaccinated individuals who end up having breakthrough infections versus unvaccinated individuals, because the unvaccinated individuals tend to get sicker. And so remember that the vaccine's major purpose is to try to prevent severe disease, hospitalizations, and death. You know, people are going to still get the virus and still test positive for the virus and could still transmit the virus, but it's really an effort to try to protect the individual. And so even if there are 27% of people who have breakthrough infections, it tends to be a milder infection and illness, oftentimes asymptomatic. And so it's that combination that you have to be looking at, not just the fact that there are breakthrough infections. And there has been a lot of information that's come out of the studies thus far that's supported the premise that the vaccine-induced immunity lasts longer at a higher level.
Thank you, Dr. Page. As kind of a related question, we have a participant asking, I received the first vaccine, Pfizer, in April. Then I got sick with COVID prior to my second shot. According to my blood work, my natural immunity is very high. If I get the second shot, won't the synthetic drug reduce my natural immunity?
Well, we haven't seen any evidence of that yet. You know, obviously a lot of this stuff continues to evolve. You know, you really, if you're taking the messenger RNA vaccines, you really need the second dose to give you that full impact of the vaccine itself. With the unpredictability and some of the unknown with the, you know, with the actual infection, you know, we would think that the second vaccine is going to strengthen you even further and not take away from your natural immunity. I think the other piece you have to remember is that, you know, we are seeing different variants over the course of time. So depending on when you got your first vaccine, when you got the infection, when you would have gotten the second vaccine, and what variant comes next, your natural immunity may be more directed towards that initial variant and much less so towards the upcoming variant, whereas the vaccines tend to have a more broad impact on, you know, even the original vaccines and their protection against Delta variant has been very substantial. So it's kind of that kind of evolutionary process that we have to remember as it relates to the vaccines versus getting the infection and the timing of the infection. That's why the vaccine, completing the vaccine series would be important.
Yeah, I absolutely agree with everything Dr. Page said. And in addition to that, you're 50% of the way there. You know, go ahead and get the next dose, because that's what we know will work. That's what the science says. So just go ahead and complete your regimen.
And the only other thing I would add, Aaron, is obviously they need to go through the same process that once they go through the infection, they need to have a resolution of the infection, feel better, you know, be 10 days out from either symptoms or test positive, and be fever-free without antipyretics for 24 hours. So they just need to keep that in mind.
Thank you. Next question, can a vaccinated person still transmit the virus to others? I believe we discussed that a little bit previously. And can you please speak about viral load and how this may relate to transmissibility?
So yes, as we said before, a vaccinated person can transmit the vaccine. Hence, we still have to be very careful. And the issue with the viral load is that the Delta variant carries a much heavier viral load, and this is why it is so much more highly contagious than the previous variant we had last year. So because of this heavy viral load, again, it's a shorter amount of time you can be in someone's presence and contract the virus. And data is also showing that it even transmit as easily as the common cold. So it is because of the viral load that this particular variant carries with it.
I think the other interesting thing is that when you compare vaccinated versus unvaccinated individuals, they both can have significant viral loads, as Dr. Biggs referenced with the Delta variant especially. But over the course of time, the rate of transmission decreases much sooner in the vaccinated population than in the unvaccinated population. So even if you get it, you're in a better spot and less likely to transmit over a longer period of time than if you are unvaccinated.
Thank you both. The next question is, if you are allergic to penicillin and clindamycin, is there any ingredient in the vaccine that will affect the body taking the Pfizer vaccine?
Not that, no, not that I'm aware of, and not that the data is showing, not that the science is showing. And as a matter of fact, I too am allergic to penicillin, and I've had both my doses. We do ask when people come in to get their vaccine if they have any allergies, and based on the answer, if you have allergies, we observe you for a little bit longer. If you don't have allergies, you still get observed. But if you are somebody that with known allergies, you would be observed for at least 30 minutes to make sure you're not having any reaction.
Thank you. The next question. I had sudden sensory hearing loss, or has sudden sensory hearing loss been associated with the vaccine? If so, how long after being vaccinated?
I've heard stories about this. I'm not sure if there's anything definitive linking it to the vaccine. And if it does happen, I can't really tell you how long it would last. I haven't heard that much about it in the literature at this point. So, I would have to probably refer you to, your doctor or an ear, nose, and throat doctor for more definitive details on that. But I've not seen a lot come out as that being a common side effect of getting the vaccine.
Thank you. The next question is, how long does the vaccine last? I had mine 8 months ago and got COVID with pneumonia.
That's another interesting question. I think as we talked about previously, a lot of this stuff continues to evolve, and different people tend to produce different results from getting vaccinated. We've seen people say that you're still pretty protected at 6 months. Some say it's longer than that. Most say that, if you're otherwise healthy, you're probably going to get a good 6 months of protection. Again, at trying to prevent severe disease, hospitalizations, and death. I think you have to remember, that none of these vaccines are 100%. These percentages of these vaccines are extraordinary, especially compared to some of the other vaccines that we've seen over the course of time, including the influenza or the flu vaccine. And so they still afford a lot of protection, but we're still going to have cases that break through that aren't part of, that even if it's 95%, that's 5%, they're still going to get infected. So, we have to tailor our expectations a little bit, but, really, be happy with the fact that the performance has been as great as it's been with these vaccines. I think that the other thing that we have to remember is that there are people with certain conditions that we're seeing immunity decrease sooner than we are in otherwise healthy people. The transplant population, the immunocompromised population, they tend not to mount as strong an immune response. So it may not be that it wanes as much or decreases as much as they just don't mount as much of it. But we are seeing some evidence in people over 65 that their immunity may be dropping earlier than the younger population. So there's still a lot to be learned about it. And everybody's kind of individually looking at it. But, you know, I wouldn't be discouraged by the fact, obviously, we don't want people to get pneumonia after being vaccinated, but this time frame thing is very difficult to nail down. And that's why, you know, this Friday, the FDA is meeting to make a decision about the COVID booster for the rest of the population as it relates to, you know, decreasing antibody levels over the course of time. So if that goes through, then this would be, you know, 8 months for a lot of people, and we would start, you know, providing the booster for other people who have been fully vaccinated. So it's a challenging question.
Thank you very much, Dr. Page. The next question, I don't think we've discussed this at all. The first vaccine dose I had was Moderna. If the science indicates that Pfizer is best for the new strand, can I switch from Moderna to Pfizer?
No, you need to continue. If you had Moderna as your first dose, it needs to be Moderna for the second dose. You must continue with whichever vaccine you had for number one. That needs to be number two as well. There's no science or no research that's showing that mixing the vaccines will give any efficacy. What we do know is you take both doses of the same vaccine within the appropriate time frames. And they both have great efficacy, by the way. They both are doing very well.
Thank you very much, Dr. Biggs. Our next question, what do we say to those that argue that the vaccine is not totally safe and mention as an example the healthcare employees, including nurses, that preferred to quit their jobs before getting the vaccine?
You know what? I asked the same question. It is really troubling. It is something that we deal with. We have to speak to each individual because everybody is an individual. We need to understand what exactly, you know, are their issues. We talk about again, this is still a novel virus, right? It's about 2 years now that we've been dealing with this. So a lot of people will say, well, there's a lot we don't know about the vaccine yet. But what we bring to your attention is that may be true, but there's a lot that we do know about COVID. So we know that getting COVID, it's like playing Russian roulette. Some people get COVID and barely have any symptoms. Some people get COVID and have really bad symptoms, end up in the hospital on a ventilator and recover. Some people get COVID and they die before they even get to the hospital. So you're playing Russian roulette, right? Some people have COVID once and they did fine. They had it the second time and they died. So we have to work with what we do know. So including the healthcare workers, we speak to our employees, we encourage them, and week by week, you know, here at Jackson Health System, we've been giving pop-up vaccine stations, and every week we're getting more and more people. So we're answering all the questions, much like we're doing here, meeting people where they are to try to help them understand the benefits, that the benefits of the vaccine far outweigh anything that they might imagine in getting COVID.
Thank you, Dr. Biggs. The next question, you've indicated that both vaccinated and unvaccinated individuals can contract and pass the virus to others. You've also indicated that the vaccinated group is less likely to know when they contract the virus, thus more likely to innocently pass the virus to others. With this being the case, why aren't we testing both groups instead of just unvaccinated, who are more likely to know when they contract the virus?
You know, I think it's a great question. I think, you know, the way I look at it is that we all still need layered prevention strategies. And so that, you know, vaccinated or unvaccinated, you're in a high community transmission area, you're indoors in a public setting, you know, we should be wearing masks. We should be cognizant of our surroundings. We should be social distancing, using hand hygiene, trying to avoid large crowds, doing all those appropriate things. I think that, if you start getting mild symptoms and you're vaccinated, especially in this day and age, it's probably, best to isolate and get tested and try to decrease the risk of transmission. And if you're asymptomatic and you don't know, I haven't seen anything that would suggest that that group needs to go through routine screening. Even with unvaccinated, we're typically testing people, that are more symptomatic, or because they're unvaccinated are at a higher risk of acquiring the virus or spreading the virus and getting sick. And so it's that combination that really creates a disparity between the unvaccinated and the vaccinated. And the vaccine still affords you an enormous amount of protection, decreasing the risk of you getting the virus, and if you get the virus, not getting as sick. But they're right in that the vaccinated individuals, if they do get symptomatic, they should follow the standard precautions. We all need to practice, in the social setting, wisely, appreciating the fact that we can be asymptomatic, still carrying it, can still spread it. So I do appreciate that level of concern.
Thank you, Dr. Page. Our next question is, how do you test for the Delta variant?
Well, we don't really test for the variants, we test for the virus. And then to test for the variants, we have to do something called sequencing, where we actually do special testing on the actual sample of the virus. And that takes a certain amount of expertise and equipment that's not necessarily available everywhere. And so the screening test is just to say that you've got, the coronavirus, the SARS-CoV-2 or COVID. But it doesn't tell you which variant you have at that point based on the screening test. That takes special testing, which is being conducted at different places across the country. We're doing some of it here with our partners at the University of Miami. And we just actually had a sequencing sample come back last week that showed that 100% of the cases here that were sequenced were all Delta. So, it's pretty consistent across the United States right now that Delta is a very predominantly evident variant that's causing the majority of the disease right now.
Thank you. The next question, and I may be able to help answer this, will the county require the third dose of the vaccine for bargaining unit L employees? Right now, we do not require the vaccination for our employees. However, if employees choose to voluntarily get vaccinated, they can opt out of our mandatory weekly testing program. I am not sure about the third dose. We follow the guidance of our chief medical officer as well as the CDC. So as Dr. Page mentioned, it looks like the FDA is currently considering whether that's going to be a recommendation. And obviously, we will be consulting with our medical experts to make that decision as to whether we will be requiring those that are voluntarily getting vaccinated to get the third dose in order to continue to opt out of the testing program. I don't know if any of you all want to add anything, Dr. Page, but that's my little 2 cents.
I think it's a little too early right now. We'll take into account all the evidence and all the recommendations and see how things go between now and then try to make, the most effective decision that we think is the safest for everybody involved. So, and remember, it's always, we talk a lot about the individuals, but it's about all of us individually. It's about our families, it's about our friends, our colleagues, our communities, and so we look at it rather holistically while understanding the significance to the individual as well. So.
Thank you, Dr. Page. Dr. Reyes, I have a couple questions that, again, I believe we discussed earlier, but if you just want to provide a little bit more information, we have a question. Which vaccine would you get if you were trying to conceive?
There's not one more than another that I would recommend, specifically because even though you may be trying to conceive, you don't necessarily know when you will conceive. It may take you 1 month, it may take you over a year. So the timing and the type of vaccine shouldn't make a difference. Most importantly, what we're really just recommending is that vaccinations happen in those people who are trying to get pregnant. And if you do become pregnant in the process, that you can continue those vaccine series as well.
Thank you, Dr. Reyes. The second question I have that I believe you can help us answer. A lot of women who have been vaccinated have lost their baby in the first trimester. Why?
Miscarriages or losing your baby in the first trimester, unfortunately, is a very common occurrence and one that many people don't speak about openly on a regular basis. In fact, 25% of all pregnancies will result in a miscarriage. So it may be confounding having the timing of having received a vaccine and then conceiving and having a miscarriage. But the current studies have shown that there has been no difference when you compare pregnant individuals who have received the vaccine and those who have not received the vaccine in terms of the rate of miscarriages.
Thank you, Dr. Reyes. The next question I have for the panel is, how safe is the vaccine for children long-term?
I mean, I think we've seen, obviously the evidence of 12 and older, that population, at least as it relates to the emergency use authorization that's come out of the FDA and CDC. Again, this is all very new, and we're continuing to monitor things over the course of time. But, we just got approval for these vaccines, in adults for Pfizer and Moderna, the latter part of 2020. So we're constantly watching. Everybody's tracking everything. They're doing a lot of trials now with children under the age of 12. And we'll have more information on that over the course of time before they're going to approve an emergency use authorization for that group. So it's an ongoing process that, we're paying very close attention to.
Thank you. The next question, and again, we may have touched upon some of the response to this. These vaccines are being represented as being safe. How can anyone make this assertion with no long-term study? Also, there's been no mention of the vaccine injury compensation program.
Again, this is where we are, right? I think as human beings living right now in 2020, dealing with the 2021, dealing with this pandemic since 2020, we just have to really stop and look at where we are. What are we faced with? What are our options? What are possibilities? This virus is 2 years old. That's all that it is. We can't make it 10 years old. So we're not going to have 10 years worth of data and information. We have 2 years worth of information. So all the decisions that we're making is based on that. The research have been going on for about that time as well. So all the facts that we can bring to you from the World Health Organization, the CDC, the studies that's being done, the registries that are in place, it's all based on this novel virus, this novel situation. None of us have been in a pandemic before. So yeah, there is no long-term information because that's why we're collecting data every day. So next year we'll have 3 years worth of data. What we do know is that this is a deadly virus. Speaking personally, for me, last week was one of the hardest weeks I've had since we've been through this in this pandemic. Yes, I'm here in the hospital and I read a lot, so I hear about all the deaths in the United States. Now we're getting near 750,000 people who have died. We see death and dying around us. However, last week, for the first time, there were 4 for me that were personal, people that were 1 degree to 2 degrees of separation from me. So it was really painful. One was a 32-year-old mother who left a 3-week-old baby. She had COVID. Thank God the baby's fine, but that baby's going to grow up without her mother. One was a young man that I worked with in my previous place of employment. He was like in his early 50s. He leaves a family with teenagers and a wife. The other one is a family that grew up down the road with my kids. That dad just went, and he was promising his family he was going to get vaccinated, and he didn't. Went through, got sick, went to the ED, went to the ICU, was intubated, extubated, was about to be discharged, then had a blood clot, which went to his lungs and killed him. You know, and then there was another one only in his 20s, just got married. The wife got vaccinated. He didn't. He got COVID and it took him out really, really fast. So what we do know is that this thing is serious and deadly. And again, it's like playing Russian roulette. So yes, we know the efficacy and the safety of the vaccine based on these 2 years or based on the time that we've had the vaccine. But what we have to deal with is where we are. We didn't have this Delta variant a couple of months ago. If we had arrested this thing back then, we wouldn't need to be having this conversation now. If we don't get vaccine where we stop this thing from going from one person's body into another person's body to replicate and mutate to become something else. You're hearing about the MU one now in California. We're going to continue having these debates and discussions, and while people just continue to die all around us. So we really just have to think about utilizing all the knowledge we have today, all the facts that, yes, we are our brother's keeper, because while we do make a personal decision, it does affect others. And really, you know, just speak one-on-one with whoever you need to really get your particular questions answered so that you can make the best decision, not just for you, but for your family, your community, your work family, and everyone who you care about and who cares about you, and even those who you don't. But this is where we are. We just have to deal with what we know.
And I couldn't agree more with Dr. Biggs. I think the only other thing I would add is that, you know, the reality is across the United States right now, 90% plus or minus of the people that are being hospitalized with this virus, with this variant, are unvaccinated. I mean, that's not a number that we're making up. That's the reality of the situation. This has largely targeted the unvaccinated population. Of the remainder, a significant percentage appear to be immunocompromised from other issues or longer out from their vaccination. So I mean, the reality is that, you know, as Dr. Biggs referenced, the risk-benefit discussion, there's really no foundation to not get vaccinated based on that.
Just to piggyback on Dr. Biggs and Dr. Page, we're seeing the same thing in our pregnant obstetrical patients. Within our private practice at the Jackson Medical Group, all of our patients who have tested positive for COVID and who have been hospitalized for COVID while pregnant have been those who are unvaccinated. And we are getting calls every single day from new moms who are pregnant, who have the virus, who have not been vaccinated.
Thank you, everyone. I know we're running kind of close on time. We're supposed to end at 1, and I really want to be mindful. There's still a number of unanswered questions. So I'm going to try to get to those that, you know, are related to topics that we haven't really touched upon yet. I have one regarding home tests and the accuracy of home tests, and if any of you all have suggestions as to whether there are specific types of home tests that are more accurate than others.
I have no knowledge of the home test at this time.
The home tests are getting better. I can't tell you a specific product name, but they are getting more sensitive as the technology continues to evolve. And so people are using them as an adjunct. I would just be cautious, as a lot of the home tests are antigen tests. And so the antigen tests, you know, require a certain amount of viral load before they test positive. And so it tends to be better in more symptomatic people. But the PCR test, the nasal swab, that has been the gold standard, is really more sensitive in picking up the virus.
The next question I have is related to the effectiveness of masks. How effective are masks in preventing the spread of COVID?
You know, the mask, social distancing and washing our hands and sanitizing our hands, it is very effective, but we must wear the masks consistently and correctly. But it is effective. Prior to the vaccine, that's all we had was the mask, social distancing, and washing our hands, and it remains very effective. It's just that now we do have an additional, addition of the vaccine to even further protect ourselves. But the mask, social distancing, washing our hands is still very effective. And even with the vaccine, we need to continue to do that.
Thank you. This is kind of a long question. Good afternoon. I'm not an anti-vaxxer, as they say, but I do really want to make an informed decision. I read that Regeneron has good effectiveness against COVID-19 if you get it early upon diagnosis. There are now published NIH studies on the use of ivermectin to treat COVID-19, and they're showing great results. And Pfizer is now coming out with its own protease inhibitor that works like ivermectin. So as the virus continues, it seems therapeutics may come into play. So my main hesitancy is as to why, with the vaccine rollout, can there be an explanation as to the blow up in cases with Dade County being highly vaccinated? And why has there been no discussion about the Regeneron clinic in Tropical Park?
I mean, I'll start off. I think the Regeneron treatment option is a great option for people with mild to moderate symptoms that don't require hospitalization, don't require either additional oxygen or oxygen support, and who don't require hospitalization, obviously. It tends to be pretty effective. At least the data that I've seen about it. So I'm a big supporter of it. At the Tropical Park site now that the state is running, they're doing a significant number of Regeneron treatments on a daily basis. So I'm a supporter of the monoclonal antibodies, the Regeneron utilization, especially in the people who meet criteria. And now we're using it in people who, especially at higher risk, that have a significant exposure to a COVID positive patient. So that piece, we're on board with. I think that the question about why are we seeing such a surge in cases, it's a combination of factors. We do have a high vaccination rate. We have a lot of people that come in, stay for a period of time, leave, travel. We're a major site of international travel. And I think that, this virus is very transmissible. I think that probably to a certain extent, people are fatigued to a certain extent, so that, hey, this has been going on for a long time. Why can't I do this? Why can't I do that? You see events are happening. You see a lot of people not wearing masks. You see a lot of people gathering. So, I think it's a combination of factors. I also think, and this was brought up on a call I had last week about seasonality, and down here, the summer gets pretty warm. People tend to stay more inside than outside. Up in the Northeast and up in different parts of the country, as we hit winter, people tend to stay inside more, and we're starting to see some trends where some of the number of cases are increasing, further north now. So some of it may be seasonality, but it's a combination of factors, including this variant, which is behaving differently than some of the prior variants. The ivermectin piece has always been a discussion. Again, this is evolutionary. Things are changing on a regular basis. And the ivermectin has not been, at least the last I saw, endorsed officially by the FDA or by the infectious disease societies as an approved treatment for COVID-19 infection, so, we try to follow the guidelines of some of our professional organizations and some of our regulatory agencies. So ivermectin right now is not one that we're using on a regular basis to treat COVID patients, but that may change. I don't know. But obviously you can find information to support different interventions that we may not be utilizing at this point.
Unmuted. Thank you very much, Dr. Page. With that, we're a few minutes over 1 o'clock, and I just want to be respectful and mindful of our panelists' time. I know you might have some appointments coming up. I apologize if we did not get to answer your specific question. We will have a few other town halls, which I encourage you all to participate in if you have additional questions. Thank you once again to our panelists. We really appreciate your time and your expertise. This is a very informative session, a lot of great questions asked and answered. Thank you again to all of our colleagues at Jackson who helped coordinate this webinar. Specifically, I'd like to thank my colleagues in the benefits division who work closely with Jackson to get this all up and running. On behalf of everyone on the county, I hope you all stay safe and well.
Thank you.
Thank you.
Thank you.